what is it about diabetes that affects so many parts of your body when you're talking about obviously your urinary system and your healing of, injuries. And I mean, that just is fascinating to me, but explain to us why, kind of in a layman's terms, why does this disease or medical condition affect so many parts of your body?
Absolutely. And I think about it through two different lenses, Amy. So before diagnosis, you have the symptoms of, frequent urination, blurry vision for a couple of reasons. One, your body is always trying to protect itself. It is meant to, provide that protection so that it can stay well and help you do the things that it needs to be doing. So when you see that frequent urination, that is often one of the first signs, again, of having increased blood glucose. And it's your body's reaction of, oh my goodness, my blood sugar is high and I need to kick into gear and to try to lower that blood glucose. And that's one of the ways that it happens. And then two, as it relates to, slow healing cuts and wounds and infections, when you think about high blood sugar, I think about it like waffles or pancakes and syrup. If you're eating breakfast and we'll just use waffles, and you get some syrup out, and you accidentally spill some on the counter, you start to kind of clean it off. You think you get it all, but you don't, because you're running your hand over the counter and it kind of picks up that is some sticky that's left over from that syrup that you thought you cleaned up. So using that analogy, the syrup, consider that kind of that high blood sugar. And that leftover syrup, that's sticky, that's what happens in our body when our blood sugar is too high. The blood is a little bit thicker, and it's wreaking havoc on the blood vessels, the tiny blood vessels that are in our eyes, that are in our kidneys, that are in our feet, and in our heart. And that's why you start to see the issues with vision, with your kidneys, with feet. So that's really why you see those symptoms that show up.